You're listening to Head On with your host, board-certified plastic surgeon, Dr. Bahman Guyuron.
I don't sit across people and tell them what else they need unless the reason that they are in my office to see me or surgery that I'm going to be doing for them is going to be suboptimal because of something else. If the patient comes to see me for the nose surgery and they have prominent ears, I'm not going to discuss the prominent ears. Or if they need some facial rejuvenation, I'm not going to discuss that. And this is something that we face every day. So we have to have some ethical rules about it. We don't want patients to become concerned about something they're not concerned about it, unless, again, it's going to interfere with our ultimate goals. There are patients that sit across me and ask me, what is that you can do for my face? And whether this is a rejuvenation or beautification, which is, again, in my view, is a good part of beautification, I'm going to analyze the entire face. We have actually a systematic way of analyzing, even visually, then as I mentioned with the life-size pictures, measurements and angles. And by adjusting those structures, we can, again, make the face to look prettier. Today, particularly, with the availability of fat injection, a good number of our goals can be met with just fat injection on patients who have hollowed lower eyelids or less than ideal prominence to the cheek area, or thin lips, or even slightly under-projected chin or a slightly asymmetric chin. I can actually adjust those with fat injection. You were earlier talk about the fillers. Obviously, the difference between the fillers are two and fat injections are main differences are two. One is that fat is more lasting and essentially permanent. Nothing is permanent. And the other advantage of fat is that it has stem cells and restores the glow to the face that we cannot get from just skincare products or even lasers. That's an amazing benefit. And so a good number of facial unattractive features can be made more attractive just by fat injection. But we use we move the bones. We adjust the frame of the nose if we need to. And earlier I mentioned that we can even move the eyes apart closer to each other. But most of the time, other procedures that we do help us to achieve those major objectives, camouflage some of the major flaws without resorting to very complicated procedures. But the analysis part is, again, visual analysis, assessment of the face, and supplemented with cephalometric analysis using life-size pictures that we do actually measure the different distances from every surgery that we do that has a function. The goal should be improving the form and function. And the reality is that good form always translates to good function.
Links to learn more about Dr. Guyuron and anything else mentioned on this podcast are available in the show notes. Head On is a production of The Axis, THEAXIS.io.